Welcome back to Inside City Hall. We heard from Governor Hochul earlier on about her budget plans. One proposal includes expanding access to mental health care for New Yorkers. Part of the billion-dollar plan from the governor includes adding new psychiatric beds, creating a supportive housing infrastructure, expanding outpatient services, and access to job training and employment opportunities, and much more. Joining me now to talk through some of that is Jody Rudin. She's the president and CEO of the Institute for Community Living, a nonprofit organization that provides services to struggling New Yorkers. Ms. Rudin also previously served as a deputy commissioner of the city's Department of Homeless Services. Welcome to the program. Very good to see you.
Thanks for having me, Errol. I'm a big fan of the show.
Oh, well, thank you. I should say congratulations, because you're one of the agencies that stood with the governor. I assume you like this proposal. $1 billion in this much-needed sector can only do good. Is it in the right proportions to really move the needle in ways that the average New Yorker will see results?
It is, Errol. This is a transformational plan that really has the potential to take us from a fragmented system of care to an integrated and comprehensive one by investing in community-based, trauma-informed services that we know work, that have evidence behind them.
One item that I noticed in the list of what will come out of this was fines of up to $2,000 a day for Article 28 hospitals. Those are basically general hospitals, I think, for my viewers' point of view, that are not providing sufficient mental health services. It makes it sound like there are hospitals that could be providing services that haven't been doing so.
Yeah, I mean, I think what the governor is trying to do here is not only look at the full continuum of community-based services and invest in making it even more robust and figure out where people are falling through the cracks and fix those areas. So there are certain areas where institutions and service providers need to have more accountability, and I think she's trying to do that alongside really this unprecedented investment in services for people who are struggling.
I noticed some things like the 988, which is the number for suicide and crisis cases. You don't necessarily have to call 911.
Yeah.
And there's a small investment there, and larger investments for things like full-time supportive housing, some of the sort of intermediate or step-down housing, lots of different kinds of services. But what I keep thinking about overall is, because we've reported on this, there have been shortages of nursing personnel and other medical healthcare personnel. Is that going to affect the ability to ramp this up? Do we have the people in the institutions ready to go with this?
It is. I think the workforce is an issue that we need to continue to look at in all of this. The governor did put a 2.5% cost of living increase for human services workers in her budget. That's a good start. You know, I think, listen, we have thousands of human service workers across the city who show up, snow, sleet, hail, who show up through global pandemics and walk alongside the people we serve, no matter how challenging their journeys get. And to all of you watching this show who do this work, I want to say thank you. So I think this is a broader conversation, Errol, about how we value this work, how we hold it up as a society, how we incentivize people to go into this work, and how we keep them there. And I think there does need to be a more substantial investment in terms of compensation.
I was going to say,
so that we can live this visionary plan.
Well, let's go further with that. I mean, your organization runs housing and mental health programs under contract with the city. There are hundreds of other agencies that do the same all across the state. How do we make sure those individual agencies are doing a good job? How do we make sure that they are holding each other accountable, that there's peer reviews, that there's objective third-party looks, best practices that are promulgated to make sure that we don't have this sort of uneven outcome where if you happen to be treated by a good agency, you get a good outcome, and others don't do nearly as well?
Yeah, I think we've seen over the last decade or so a shift in government holding nonprofit providers accountable for achieving outcomes, for implementing things like performance-based contracts. I also think we have to look at the people who are receiving the services and ask them how they're feeling. Are they getting better with us?
Sure. Sure. Is that the best metric? What's the how will the public who's paying for this, the government that's supervising it, and most importantly, the patients who are being treated, how do we make sure we're all using the same metrics and getting the best outcomes?
Sure. So certainly talking to people who are receiving the services is absolutely critical. I'll tell you, I mean, some of these investments, we all know that supportive housing is the best prescription that a doctor can write. And that's why I'm particularly excited about these 3,500 units. And when people go into supportive housing, they stay there. You know, over 90% are still in the housing unit a year after moving in. And when we pair housing with wraparound services like assertive community treatment or the critical time intervention teams that the governor is funding in her budget, we see hospitalizations go down by 80%. So we absolutely need to be talking to people who are receiving the services, and we need to be looking at the data. We should have an expectation that when you pair, for example, housing with wraparound services, that you're going to see a reduction in hospitalizations.
You know, and within this, there's something that, you know, we report it so often, and I've seen this for years. Like, it's very frustrating. Is there going to be, you know, sort of a unified, portable, cloud-based record that's created when people come into city care or state care or agency care, where instead of starting all over again, you know, who are you, where do you live, where are your meds, what are your meds, that we can sort of like, you know, do it once and have everybody maybe pick up where the last service provider left off?
Yeah, I think that's conceptually what the governor is driving towards here in terms of figuring out how to integrate these services. So she's funded over 100 mobile treatment teams, again, assertive community treatment, these SOS, safe option support teams, critical time intervention teams. And the idea there is that when the team is working with the person who's struggling with a mental health challenge, and then that person, you know, enters into another system, whether it's a hospital or a jail, that the team is there to be the connective tissue to follow the client through, ultimately to permanent housing, so that you don't have to go through the same intake process 5 different times, so that there's some cohesion and continuity in how you're receiving care.
Okay, this is very promising, at least conceptually. It's good to know that there are experienced professionals who think that they're on the right track. We'll check in with you from time to time, if you don't mind, to see how things are going.
Great. Thank you, Errol.
Thanks very much.